Hey guys, my name's Samantha Lackey and I'm coming to you from the offices of Mountaineer Hearing in Conover, and Black Mountain is where I see patients. And today we're going to talk a little bit about what causes tinnitus, okay? Tinnitus, or ringing in the ears, as some folks may say, is a perception of sound when there is no external sound present. In some really bad cases, there's objective and subjective tinnitus. In some cases, the healthcare provider can actually hear it externally. Many patients describe the sound as high-pitched ringing, but it may also be clicking, buzzing, whooshing, roaring, and hissing. In most patients, tinnitus occurs gradually. It can significantly impact the quality of life, causing depression, anxiety, and loss of concentration. So tinnitus can be caused by a number of things. One of the main things is, we've all heard the term hair cells. They're in our cochlea, and when they're damaged, that's what receives the sound, and that will sometimes cause the ringing or perceived ringing in our ears. Changes in how our blood moves through the vessels, the carotid arteries, problems with our joints of the jawbone, the temporal mandibular joint, TMJ. That's another thing that can cause the ringing, and problems with how our brain perceives sound. Tinnitus is usually caused by underlying conditions such as age-related hearing loss, an ear injury, or problems with circulatory system, just like what we said. For many people, tinnitus improves with the treatment for those underlying conditions. That reduces or masks the noise, making tinnitus less noticeable. Hearing aids is a treatment for that if you find that you have hearing loss. The diagnosis of tinnitus is based on a patient's history. Questionnaires also help access how much tinnitus is impacting the patient and their quality of life, because sometimes it's very, very bad and it's just hard to deal with. Prevention of tinnitus involves avoiding loud noises, seeking appropriate treatment to prevent the condition from worsening. Treatment management of tinnitus is the use of a sound machine, like the noise machine at night. I know I have tinnitus only on my right side, but when I lay down to go to sleep, that's when it's really loud. It's when I take my hearing aids out. I too wear hearing aids, and it's very loud and annoying. But a sound machine does help. Hearing aids is a treatment for tinnitus, tinnitus counseling, tinnitus retraining therapy. There are programs within the hearing aids that we as providers can add for someone that has, altering tinnitus to help with that. There are many different forms of hearing loss. In tinnitus, absence and reduced activity of the nerves. These are tiny, delicate little hair cells in your inner ear, the cochlea. They move within your ear and receive the sound waves. This movement triggers electrical signals along the nerves from your ear to your brain by the auditory nerve. And we've talked about that a couple sessions before, how we hear with our brain. Your brain interprets these signals and as sound. If the hairs inside your inner ear are bent or broken, this happens as we age, or when you're regularly exposed to loud sounds. They can leak random electrical impulses to your brain, causing tinnitus. Another cause of tinnitus is medications. There are several types of medications that can worsen the tinnitus. Usually higher doses of medications aggravate it. Once you finish your doses of the medications or your physician has you come down, the ringing stops or it improves. Another cause of tinnitus could be a head or neck injury. A lot of times it comes on after what people describe as whiplash. And it shows up, studies show that about approximately 12% of people suffering from that have had a whiplash in the past. In this group, approximately 33% experienced it when a whiplash is sustained. Another thing that can cause tinnitus or tinnitus, that's another way, is noise. Noise-induced hearing loss occurs when your daily excessive sounds are extremely loud and it's all the time, and you have damage to sensitive structures, the hair cells within the inner ear. It can be either immediate or gradual, temporary or permanent. And another cause is osteosclerosis. It's an abnormal growth of bone surrounding the stapes bone in the middle ear. When those little bones start to stiffen, it prevents them from moving, and arteriosclerosis can gradually have hearing loss. It can cause dizziness, it can cause balance issues, and tinnitus. Another cause of tinnitus could be tumors. Some tumors, such as an acoustic neuroma, can cause tinnitus. An acoustic neuroma, also known as a vestibular schwannoma, is a benign tumor that develops on the cranial nerve, which controls balance and hearing, and it can cause tinnitus in the affected ear. Another cause of tinnitus is smoking. Cigarettes contain many chemicals. Same thing like the medications. Chemicals, and there's all kinds of fluorohydrin, arsenic, vinyl chloride, hydrogen cyanide, ammonia, and nicotine. Some of these substances are Oto Toxic, so they can impair hearing and result in unsteadiness, dizziness, and tinnitus. These chemicals in cigarettes can constrict the blood vessels and thus reduce the blood flow to all parts of the body, including the inner ear, just like we talked about back a few seconds ago about the blood flow. Another cause that can affect the ringing in your ears is the TMJ problems. TMJ is side-to-side movement, front-to-back movement, painful chewing during eating, when you glitch your teeth at night and you hurt right up in here, that is usually related with TMJ. TMJ syndrome includes face and jaw pain, headaches, neck pain, earaches, limited jaw movement, difficulty with opening your mouth, and tinnitus. The TMJ syndrome and tinnitus are closely related. In fact, those with TMJ syndrome are more likely to develop the tinnitus. Some other TMJ issues include dislocation and arthritis. Patients with TMJ syndrome also tend to grind their teeth when they sleep at night. Meniere's disease. Meniere's disease is an inner ear condition that can cause vertigo, a specific type of dizziness in which you feel like you are spinning. It also can cause hearing loss that fluctuates. It comes and goes. and a feeling of fullness or pressure in the ear. Meniere's disease is a progressive condition that can result in permanent hearing loss. It can affect individuals at any age, but most commonly occurs in adults in their 40s and 50s. Meniere's disease can cause dizziness, muffled hearing, tinnitus, depression, and anxiety. Another cause of tinnitus is ear infections or ear canal blockage. Your ear canals can become blocked with a buildup of fluid, which is ear infection, earwax, dirt, or other foreign materials. A blockage can change the pressure in your ear, causing tinnitus. Other causes of tinnitus is eustachian tube dysfunction. In this condition, the tube in your ear connecting to the middle ear to your upper throat remains expanded all the time, which can make your ear feel full. You can have muscle spasms that can also cause it in the inner ear. There's two little muscles that are in there. Muscles in the inner ear can tense up and spasm, just like we have muscle spasms in other parts of our body, which can cause tinnitus, hearing loss, and a feeling of fullness in the ear. Sometimes happens for no explanation, but can also be caused by a neurological disease, including multiple sclerosis. Blood vessel disorder. Conditions that affect blood vessels, such as arteriosclerosis, high blood pressure, or kinked or malformed blood vessels, can cause blood to move through your veins and arteries with more force. These blood flow changes can cause tinnitus and make tinnitus more noticeable. And I want to say that if you are experiencing any of this and you do have the ringing in your ears, first go to your medical doctor and, talk to them about it. And if you want to come here, we can also do a hearing eval and a case history and then refer you out if need be. One of the preventions for tinnitus in many cases is a result of something that can be prevented. However, some preventions can help prevent certain kinds of tinnitus using hearing protection. Over time, exposure to loud sounds can damage the nerves in the ear, causing hearing loss and tinnitus. Try to limit the exposure around loud sounds. Always use ear protection. Turn down the volume on the radio. Long-term exposure to amplified music with no protection, or listening to music at very high volumes through headphones or earbuds can cause damage, hearing loss, and tinnitus. Take care of your cardiovascular health. Exercise regularly, eating right, and taking other steps to keep your blood vessels healthy can help prevent tinnitus linked to obesity and blood vessel disorders. Limit your alcohol and caffeine and nicotine intake. These substances can use, especially when you use in excess, to affect the blood flow and contribute to tinnitus. And today we've talked about a number of things. If you have any concerns for a loved one that's experiencing a hearing loss or ringing in the ears, have them or yourself give us a call to make an appointment, to schedule an appointment, and we will do a hearing eval and see where we need to go from there. If we need to refer you out, we will. And there's no cost. We do absolutely free evaluations. You can contact us in our Black Mountain office or Conover, and we have other offices available. There's a number below that you can reach, and you can also schedule online. Thank you again. I hope you have a great day.